Caraga, Contra COVID-19, bringing you the updates of the Corona Infectious Disease 2019. Maayong adlaw, Caraga Region, ug sa mga gasubay online. Kini nga programa giuluhan sa Department of Health, Caraga.
Mayong adlaw, aniya nasabta karon sa programang Caraga Contra COVID-19. Ug karon akong gihawag atong Regional Director Jose Arliacuna Jr. para sa paghatag sa Caraga Situational Report ug iyahang mensahe.
Greetings of good health and peace, mga kaigsunan. On the national scene, we have 5,878 COVID-19 cases, 487 recoveries, and 387 deaths. In Caraga, we have 9 suspect cases. 1 from Agusan del Norte in Asipit District Hospital, 4 from Butuan City, admitted at Butuan Doctors Hospital, 2 of them, 1 from CRH or Caraga Regional Hospital, and 1 from Butuan Medical Center Annex. 2 are from Tandag. 1 is admitted at Butuan Doctors Hospital, and 1 is in strict home quarantine. We also have 1 from Agusan del Sur at Esperanza Community Hospital. We also have another one in Cabadbaran City under strict home quarantine.
Thank you, Director Lacuna. Para sa paghatag sa update sa Hospital Compliance Monitoring Team, akong gihawag ang atong Assistant Regional Director, Dr. Rodolfo Antonio Albornoz para niini.
Maayong adlaw, Caraga. As the chair of the COVID-19 Hospital Compliance Monitoring Team, I'd like to give to you an updated status of the isolation beds on the following hospitals. For the Caraga Regional Hospital, we have 5 available COVID isolation beds. For Adela Cerati, we have 12. For the St. Paul Surigao University Hospital, we have 1 occupied bed. However, that patient is a non-COVID-19 patient. For Andres Soriano Memorial Hospital, we have 3 vacant COVID isolation beds. For Butuan Medical Center, we have 7. Nasipit District Hospital, we have 13. For the Manuel J. Santos Hospital, we have 1 COVID isolation bed. However, it is occupied by a non-COVID-19 patient. For the Butuan Puericulture Center, we have 1 vacant COVID isolation bed. For Butuan Doctors Hospital, we have 5. For the D.O. Plaza Memorial Hospital, we have 2. And for the San Francisco Doctors Hospital, we have 3. All in all, we have 52 vacant beds dedicated for COVID isolation, COVID patients. With these updates, we would like to remind these hospitals on the directive signed by the Secretary of Health that patients should be attended to. For these hospitals are equipped with isolation rooms and should have the capability to manage infectious patients or infectious cases. Thus, there is no sufficient cause to refuse COVID-19 patients. Refusal to provide care to the said patient is considered a violation of the Department of Health directives and the President's marching orders, and they shall be dealt with accordingly.
Thank you, Dr. Albornoz. For additional updates, akong gihawag pag-usab ang atong Regional Director, Dr. Jose Arliacuna Jr.
Late this morning, CHD Caraga received a sample or result of the samples we sent to SPMC. This refers to the second follow-up of the post-positive COVID-19 examination. Mahinumduman nato ang first was negative ug karong adlaw man kaigsunan ato usab na dawat ang negative test result. At about the same time, we also received the results for a 47-year-old male admitted in a Sipit District Hospital. The yield was also negative. Today and tomorrow, a team from the RITM, or the Research Institute of Tropical Medicine, from the Department of Health and the World Health Organization will visit the two DOH hospitals in Caraga. Today, in Adela Serrati Memorial Medical Center, and tomorrow in Caraga Regional Hospital for the physical assessment in our plan to put up a sub-national laboratory here in Caraga. My friends, nag-anam na kadaghan ang mga tests na himuon sa atong rehiyon. Thus, there is a need for us to have a sub-national laboratory. As we are preparing for the PCR test for COVID virus, ang atong mga kagamhanan, labi na sa dakbayan sa Butuan, nagsugod na usab sa ilang rapid antibody diagnostic tests. I repeat, the antibody diagnostic test is only presumptive and can only be confirmed by the Department of Health when the swabs are processed in a molecular laboratory like Southern Philippines Medical Center. Sa 19 ka samples nga atong gihatod dito sa Davao, 13 are found to be negative while the rest are still pending.
Thank you, Director Lacuna. Ug karon karohon nato ang ligawas nga mga balita mahitungod sa suspect COVID-19 patient nga namatay sa Butuan Doctors Hospital. Akong giawhag ang atong Chief Administrative Officer, Dr. Jerna Manatad, para sa pagklaro niini.
Kay mayang adlaw sa tanan, sa ginaingon kaganina nga naa kitay pending pa nga resulta sa laboratory test result nga kini nga kaso as earlier nga gi-share sa atong regional director, gikan kini ang iyahang residence is from Tandag. Initially, the patient was admitted at Adela Serrati Hospital, a 38-year-old female with pre-existing medical conditions. Ang primary nga complaint ni ani is seizure. So the patient stayed in Adela Serrati Hospital and then managed with no other respiratory signs and symptoms. However, on April 13, the patient was transferred to Butuan Doctors Hospital for further evaluation, primarily to receive a management coming from a neurologist. Now, while staying in Butuan Doctors Hospital, on April 14, the patient developed difficulty of breathing. Mao na ang pasyente gi-transfer sa ICU and then endotracheal tube was done. Endotracheal intubation was done, and naay rapid nga deterioration ang pasyente no, primarily sa iyang pulmonary nga function. The pulmonologist started to consider the case as a COVID suspect. Unfortunately, the patient died the following day, April 15. Since gi-consider siya as COVID suspect, ikuhaan nato specimen and then gipadala sa Southern Philippines Medical Center. And today, as the regional director said that we received now the result, it turned out to be negative. So negative ang atong result sa kadtong namatay nga pasyente last April 15 nga taga Tandag City.
Thank you, Dr. Jerna Manatad, para sa pagklaro niini. Para sa atong breaking news, sa makausab akong giawhag atong regional director para sa paghatag niini.
Mga kaigsuunan, aduna kitay bag-o o confirmed COVID-19 positive nga kaso dinhi sa atong riyon. Subo nga balita, pero kinahanglan nato kining maisugon nga tubangon because the only way to meet the challenge is to meet it head-on. CHD Caraga nadawat ang resulta kaganiyang hapon, mga alas 3 sa hapon. The patient was a 65-year-old male from Butuan City with no pre-existing medical condition and is currently admitted at Caraga Regional Hospital. He has been tested negative, but due to the insistence of the attending physician, a repeat swab was done, thus this result. The said patient has no history of travel. However, he has a close contact with a relative who went to Davao City for the Araw ng Davao Six-Cock Derby in New Davao, Matina, Galleria last month. At present, the patient's condition is closely guarded with oxygen support.
Daghang salamat, Director Lacuna. O karon atong tan-awon ug paminawon ang kalanbuan sa kondisyon sa atong confirmed COVID-19 case nga tuwa sa Caraga Regional Hospital na ihatag ni Dr. Kenneth J. R. Q. Alberca, Medical Specialist 2, Operations Section Chief for COVID-19.
Good afternoon. 10 days ago, we received a referral from Butuan City of a 65-year-old male who complained with fever, cough, and progressive dyspnea. He has no known comorbidities. On further questioning, we extracted a history that the patient has a close contact with a relative who went to the Six-Cock Derby in Matina, Davao. With his history, together with the patient's signs and symptoms, we admitted the patient in our institution and got some laboratories and sent the swab specimen to SPMC. While waiting for the results, we managed the patient as acute respiratory distress syndrome secondary to pneumonia. 3 days after, the results showed negative for SARS-CoV-2 virus. However, putting together the patient's history, signs and symptoms, and the patient's chest x-ray and laboratories, which shows otherwise. That is why I requested for a repeat swab to confirm my strong suspicion of COVID disease. Currently, the patient's condition is still guarded with oxygen support but showing signs of clinical improvement.
Daghang salamat, Dr. Kenneth J. Alberca of Caraga Regional Hospital. Sa makausab, atong gipahinmunduman ang publiko nga magpuyo ta sa atong balay, mugawas lamang kung importante. Ikaduha, maghugas sa atong mga kamot. Ikatulo, proper cough etiquette. Strengthen your immune system. O kung aduna mo'y laing gipangbati sama sa ubo, hilanat, lisod paginhawa o kalibanga, adto sa pinakaduol na hospital o tawag sa DOH hotline numbers. DOH Caraga hotline numbers 817-6546, 0945-359-2632, 0948-224-1857. For mental health and psychosocial support services through telecounseling for Caraga State University, adunay pipila ka mga numero na pwede tawagan depende sa oras. For National Center for Mental Health Crisis, kindly dial the following hotline. Agusan del Norte. Agusan del Sur. Surigao del Norte. Surigao del Sur. Province of Dinagat Islands. For DOH official Facebook page, Kindly like DOH Center for Health Development, Caraga. Sa makausap, atong giyawhag atong Chief Administrative Officer, Dr. Jerna Manatad, para sa closing message.
Sa ginaingon kaganina sa atong regional director nga atuna kitay bag-o nga kaso sa atong confirmed case, among gipahinumduman o gipahibalo ang atong publiko nga ang Department of Health nakig-koordinar sa local government unit o maingon man sa OCD o other nga mga membro nga organisasyon nga importante nga naay role nga ani labi na gyud no sa atong contact tracing. Naanay initial nga mga contact tracing nga nahimo apan ato paning ipadayon tungod kay pinaagi sa resulta nga atong nakuha karon, importante gyud no nga masuyod nato kinsa kadtong close contact sa atong kumpirmado nga kaso. So giawhag namo ang kooperasyon sa tanan labi na sa mga close contact sa pag-report dayon kung naatay bation nga simptomas sama sa hilanat, ubo, no o maingon man kaning sore throat ug uban pa nga mga simptomas sa ato ang ginaingon nga sa respiratory nato no nga function. So ginaawhag nato ang atong katawhan sa pagpabilin no nga mo kooperar kita sa atong ginaingon nga enhanced community quarantine. Unsa man kini again kining atong ginaingon nga stay at home, physical distancing sa ato ang uban nga kaubanan sa ato ang pamilya or sa komunidad. O again, among gipahinumduman ang usa sa very important usab nga makapugong gyud nga dili mo kaylap kining kaso sa atong COVID, padayunon nato uno nga magmalig-on ang ato ang resistensya sa atong lawas. O uban pa nga mga pamaagi nga gina-share namo kanunay. Ganina ginaisgutan usab ni Ma'am Joy unsa pa kadtong mga pamaagi na atong mapugngan ang pagkaylap sa kaso. So from time to time or regular nga panahon kung kinahanglanon gayud nga ang departamento sa atong panglawas pinaagi sa atong regional director, sa atong assistant regional director ug uban pa nga mga key officials sa ato ang komunidad magpahibalo gayud kita kung unsa ang kalambuan or update sa atong sitwasyon sa COVID sa tubuok rehiyon.
Thank you so much, Dr. Jerna Manatad. Ug mao katong balita karong adlaw, stay safe, Caraga. Daghang salamat.